first step that is done is the bimanual pelvic examination, which is done by the gynecologist. And once the patient is examined by the gynecologist and there's a suspicion of some amount of chances of cancer being there, then what we do is something called the pap test, that is pap test or pap smear. And along with that, on the same smear, HPV typing test is also done. Now, there's a way of which the cervix can be seen better by the doctor, and that's called colposcopy, to help guide the biopsy of the cervix. So once we see, then we do a biopsy, and that biopsy is then examined under a microscope, and we come to know whether there is cancer there or not. And then we do an MRI to measure the size of the tumor, and we do a PET scan to see whether it has progressed or into other parts of the body or not. So once we are diagnosed, the treatment is conducted by a team of doctors. It's called a multidisciplinary team, which includes the medical oncologist, that is myself, my surgical counterpart, and the radiation oncologist. To prevent cancer from spreading, different procedures are used depending on the stage of the cancer that which we are dealing with. So treatment will be localized or systemic. Localized for early stages of cancer, and the most common form of localized treatment is surgery, which involves the removal of the tumor and some surrounding healthy tissue during an operation. Next comes radiation therapy, is used where we use high energy X-rays or other particles to destroy cancer cells. For early stages of cervical cancer, a combination of radiation therapy and low dose weekly chemotherapy is often used. Now, what is chemotherapy? Chemotherapy basically means chemicals or medicines given to destroy cancer cells. With the recent advancement, we do have something called targeted therapy and immunotherapy. Targeted therapy is a treatment that targets cancer's specific genes, proteins, or the tissue environment that contribute to the growth of the cancer and survival of the cancer cells. Immunotherapy, it uses the body's own natural defenses to fight cancer by improving your immune system's ability to attack, identify, and kill the cancer cells. Cancer and its treatment has an emotional, social, and financial effect. Managing all these effects is called palliative care or supportive care. People who receive palliative care along with treatment for cancer often have less severe symptoms and better quality of life. And that is why at Pace Hospital we believe in giving a comprehensive care which includes not only the chemotherapy but along with that palliative therapy, that is palliative care. So what I tried to tell you so far was what is cervical cancer, how is it caused, what are the signs and symptoms, and how do we investigate and treat. But the most important point, the message that I want to give you at the end of this talk is prevention. Cervical cancer is a preventable cancer. That's very, very, very important. Please understand, it is possible to screen and treat cervical cancer in the early stages, but the problem is that the information on screening behaviors of Indian women is very little. So I'll request you, whatever information I'm going to share with you now, please disseminate to all your friends so that they become wiser, and then request them to please disseminate further. If cervical cancer is found early, it's highly treatable and is associated with a good quality of life. That it can be prevented by having regular screenings with pap test and HPV tests to find any pre-cancers and treat them. It can also be prevented by receiving the human papilloma virus vaccine. It is noted that both males and females should ideally be vaccinated. All sexually active men may not even realize that they have been infected with the HPV virus and is usually just asymptomatic. So it's very important that men and women are vaccinated against this virus.